Good afternoon, dear colleagues. I would like to tell you about the work that is done by our commission, mainly using the concept of real-world data and real-world evidence in the regulatory practice of pharmacosurvey. So this issue is mentioned in various acts, and the main terms RWD, RWE are included in the rules of registration, whose amendments were adopted in March. I will speak about them in more detail later. This year, we have also adopted renewed version of the proper practice of good practice of pharmaca survey, and it was the decision was made on the 19th of May of 2002, and now we are preparing the we are working on it. Preparing a project. We work with the renewed version of the rules for good clinical practice. These documents are still underway, but as soon as we agree upon the version for public discussion, we will publish it. It is important to say that recently the profile working group that works on standards put forward the concept of using the real-world data. Now the project is being prepared for public discussion, and in the fourth quarter of 2022, we will place it on our site, and you are invited to give your comments. If the first two acts are the decision of the Council and they are obligatory on the territory of Eurasian Economic Union. As to the concept, that will be just it is a programmatic or strategic act that defines the further development, and it will be used for regulation in the Euro-Asian Economic Union. It describes the international experience and prescribes further steps. As to the rules of registration, so the use of RWD, RWE is quite a general issue, but still the concept introduced it into the economic field of the Eurasian Economic Union, and the terms that are given there real-world data are considered as data related to the state of the patient's health and the process of medical care received from different sources. And a separate term is real-world evidence that is obtained on the basis of the real-world data. These are evidence in respect of application and potential use, potential benefit or risk of this medicinal drug application. There is a special provision in the decision of the Council of 17th March about the necessity to provide information, evidence that is received on the basis of the real-world data. As to the presentation of data of real-world data in the registration file, it is necessary to say that it is very important to present the data within the documents in accordance with the pharmacovigilance documents. First of all, it is There are several modules here you see. Model 5, for example, includes clinical study reports. As to the rules of good pharmacovigilance practice, we should note two things. First of all, we added the term post-registration study of safety, and that is a special trial related to the registered medicinal drug in order to define, characterize, and assess the threat to safety. Also, there is also a point that says that this data should be used for the safety trials. Thank you very much for your attention. I would like to say that in the middle of October, this project will be placed for public discussion, and you will have a month to make your comments and proposals on